Hello everyone. Now we talk about development management disaster warn in Indonesia. We talk about how to make algorithm about management of disaster warn in a globally and specific for Indonesian country. Indonesian have fires rings in Pacific with low to high tectonic activity. So Indonesia need management to all area because many mountains, the active mountains in 5 islands, the big island, the Sumatra, Borneo, Kalimantan, Java Islands, Bali, and the Papua Islands. So many islands and many mountains in here in Indonesia. So Indonesia needs some disaster management for this country. Beside of the eruption of mountain, the active mountains, any disaster such as earthquakes, and then tsunami, and then fluid for continue. So many active mountains, especially Krakatau, Tambora, Berapi, or in Sumatra have Sinabu, volcano, and the others. So this is the basic to do how to do for the condition in Indonesia. The natural disaster, especially earthquakes, wind, the extreme wind, and the fluid to improve to influence many people in Indonesia. Sometimes we cannot the community not just shock and do not know anything to collect it, but some community have many wounds due to the stone, the many equipment in around them. Depend of characters of disaster. The character is disaster, earthquakes, or fluid one can be contaminated by Dutch, by porridge, or in water of the sea, and some the cracks of things. So the one can be appear and contaminated. After that, decide that society will live in disaster, will is going to uh, feel emotional pressure, especially anxiety and of fear. Sometimes feel will not get sleep, and some psychological symptom. This is the standard is who people get uh, some disaster, especially natural disaster. BNPB working. BNPB is the government organization is working to the area in local area, local government to help society, to help people uh, for uh, many disaster in Indonesia. This is the list of all area in Indonesia, area province. It's mean Aceh, Pidijaya Aceh, in December 2016. This is disaster, uh, many disaster going for earthquakes, and then earthquakes, no earthquake, volcano in Sinabung. Sinabung is mountain. So in North Sumatra, it is a province. They have two mountain. One of mountain, it calls Sinabung going to full give eruption in March 2018, and then have a fire in forest in Peru. It is the Aceh province, with the same province in the list one, and then have Lombok. Lombok is province near Bali, with earthquakes in July 2018, and then this is the biggest, the more bigger disaster, earthquakes and tsunami in Palu. This is Songgala, Donggala, Pegimoto. It's a Central Sulawesi in October 2018. is a lot of the big disaster, many help donation to this province, and then tsunami in Banten, Lampung. Right? It is this area near to Jakarta and Bandung, and it is December 2018. This is fluid in Samarinda city is Kalimantan in June 2019, and then fluid in the Jakarta and Bogor, because so many making some hosts, make up some public hosts in there, and the irrigation in this river in Jakarta and Bandung not optimized, so can be fluid COVID there in January 2020. This is it's called so many natural disaster in Indonesia, and to predict it in future, so many disaster can be happen in Indonesia. So we cannot prepare preventive and give a training to society or to the nurse, health profession, to give how to about one management born in disaster. Based of the natural disaster and traffic one type of horn is traumatic ones is 66 persons. This is the biggest, the majority is followed open fracture 119 persons, because someone going down because so many house cracks and to cracks the board and the area. So this is the third is a burn because so many fires, so many area will costly when the disaster will be going. And diabetic foot ulcer, when from the patient diabetic in this area, some stoma, colostomy, ileostomy, this is low because this is the patient. Any bite, some people have bites from the animal, like insect or some already forest something, bone cancer, and freezer injury. So many warn and injury in this disaster, but the majority is traumatic, open fracture, or and a burn. What is the role of nursing? Role of nurse to do the disaster? What's first going to do? First, give a first aid immediately can help to heal the small wound faster. It is mean it is to help people then to reduce the morbidity. Some people with the open fracture widely and to prevent the infection and the other serious complication, especially tetanus. This is potential to help people and to help the other area organs and to give a soul for the, the, the people in disaster. We call this survivor. Disaster in family give uh, give us experience and the knowledge to impact the development, the strategic protocol based on the data and the case study. We call it. We believe that we need the effective wound wound care, especially for the provide safety and the based on evidence and the evidence base can be priority, and all provision and the doctor need to understand how to the treatment early and immediately treatment for the patient with the wound and to approach with infection, to reduce infection. The disaster, so many wound and so many non-sterile area. So we need to reduce infection and then morbidity and a global mortality. So we need to the strategic plan by develop to how to respond the emergency situation. Risks of emergency situation in focus for the patient management in the rural situation. So before to take 2 minutes evaluation and to and the no and the minutes of care basic one. So the situation shall be code A, and the time we need more few days after the disaster happened. So the first phase, the first phase, you need focus to manage patient, to know the about risks the emergency situation. In step one, nurse need to need and understand the situation with the standard the standard algorithm with a primary survey, uh, how to the life assessment, and to bring patient out from the harm is a priority. The early intervention include to maintenance airway, breathing, and circulation. It's called ABC, airway, breathing, and circulation. So this is the standard protocol to make the area is safe. Yeah, you need to the good act and practice for this. For the many people or many situation there, are we breathing and circulation in this disaster? After that, if you look bleeding, you can the direct pressure or use some tools like tourniquet. If you don't have tourniquet, you can use the other uh, things like cloth or something to make strict the area, to make preserve this bleeding, this area of bleeding until the bleeding is stopped or reduced. This is your responsibility for this, the first step. We call code A. We cannot do clear is area, is airway, breathing or circulation, and then you need the management of bleeding there. The second phase is a uh, four step. If each of them contain a few clinical clinical text, it can be code B, C, D, and E. And this is decreed to help and to help how to assessment assess the wound, and then which the recommendation for the step to help the process of healing wound. And then to minimize the risk of sepsis and the crash syndrome. So the second phase, this is more tax, this is more activity for nurse do or health profession is to do some assessment and doing the management plan based on the assessment. Its goal to minimize the sepsis and crash syndrome. The step 2 is a mean code B, C, D, and E. We start from code B. Code B, it means baseline words assessment. One assessment is a process to help the clinical decision, about the treatment or the care for patient. Assessment start from the overall patient condition to decide comorbidity and the other factors to prediction healing response. So you must know about the assessment. Assessment need reassessment every 48 hours to see the progress of wound healing and to predict the wound care, the outcome of wound care. Based on this theory, you must know about the assessment. We need more assessment and to know the progress. One assessment of nurse is about a characteristic of one. Its goal is include the location, shape, size, depth, the circle, undermining and tunneling. We have necrotic tissue, accident, type of accident, the color of skin in the round, have a udam. You can go to the British Johnson one assessment tools. This by the tools you can know about the one assessment and the progress of the one, and can be predict how to give a wound care and the outcomes of wound care. After that, after the assessment, based on disaster, you know about the forest things, identifies and to chop out, remove from other things, the foreign things in the body, and to note every symptom and some disorder, and about the wound drainage. So it is about the baseline of wound assessment. Step 3 is about code C, is cleaning. Cleaning is used by irrigation the right irrigation use non-cytotoxic. It is like normal saline or the waters from from waters, sterile waters, the cleaning waters uh, is significantly to reduce the risk of wound infection. Based on the appearance of wound, skin in area in the symptom systemic infection, doctors may be uh, to know use the antiseptic, the smooth antiseptic, cleaning and debridement um, uh, is clearly need to remove the fringe of the broken tissue in order to in order to in order to reduce contaminate and risk of wound infection. So this step you must know about to cleaning the wound. It's help to remove bacteria by antiseptic and to remove the foreign things from due to disaster. So the clean one can be make some healing process will be uh, progress because the wound is cleaning, not dirty one. It is the goals of this step. Step 4 is D, dressing and documentation. The dressing, the bandage you choose to provide and to maintenance with the moist and to increase epidermal migration epidermals, and then to support uh, create the new vascular and synthesis of tissue. It is probably have gas exchange between the wound tissue and the environmentals to maintenance some temperature of environmental within to increase the blood the blood uh, to one basic to one base and the increased epidermals. This migration uh, must be give a safe and protect from bacterial infection, but the dressing or bandage uh, must not to strict in the wound and easy to remove after the after during the healing process, and must be sterile, not poison, and not allergic for the skin. So the step 4 is mean coded dressing. You must choose about bandage. Which bandage compatibly with the wound. Bandage can give the new tissue, to create new tissue, to develop new tissue, and give the vascularization in this wound, in base of wound. So is a point there in the step 4, and the bandage you choose by the not poison, not allergic, and the bandage must be sterile for virus. And then treatment the wound with the bandage with advance with the alginate hydrocolloid form, and patient must be given is the strict instruction to follow themselves about the infection symptom. It's include we have give a warm, erythems, a pain, give some edema, and drainage of the wound. So this is the advance of the wound. Use some medicine, alginate hydrochloride in uniform, and the patient must look the wound, look about the infection. After that, we need the documentation about wound assessment. We need the picture, the photo, the visual accurately, and to help to create progress of patient condition. The many photo not only with function as one node in the and in the start, in the beginning, and validated from the result of treatment, which overall the photo can be the effective tools for the transfer or to give chance of cause, or to give knowledge for patient and motivate. Many technology can some help to report about the emergence condition. After that, acceleration can help the improve, continue with the situation. So the step 4 is talking about the debris demand and documentation. And the final step is stop and code E is evacuation and transfer. After to make sure the code A which follow is followed and code B, C, and D after the to X and patient uh, will transfer to the base camp or the hospital, emergency hospital or hospital. The 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 care of pre-hospital, it's important for the patient with the open wide open wide wound, which significantly or the emergency injury, extreme injury or severe injury. Maybe uh, based on the journal, antibiotic management by oral or by intravenous can be given by health provision to control the risk of infection. Normal saline as a fluid with not cytotoxic must be given because risks of hyper hyperkalemia, severe hyperkalemia uh, can be happened previously and uh, not to do with accurately uh, about the urine, the output of urine. So the code E is about transfer and evacuation the patient to higher healthcare and facility, and then to give some antibiotic to control the infection and to stop hyperkalemia. And after that, you know about the output of urine to maintenance output urine 1 until 2 milliliter plus kilogram plus hours. In step 4, the bleeding must be controlled. This is the responsibility of the health profession in the step 1. How about evaluation? The healing process usually in conducted by four phase but sometimes overlaps, which is hemostasis from start until few hours after injury, and step 2 phase 2 is inflammation 1 until 3 days, proliferation 4 until 21 days, and remodeling 21 days until 1 year. Transition from inflammation to proliferation is the key during one healing and evidence about the trouble transition with the chronical development, chronic wound and wound infection. The doctors need some basic of their reason about therapeutic intervention about this knowledge. So you need for the healing process, you need to transition inflammation to proliferation. This is the the key to help to give one healing. And this is a step 6. It's about code F. It's a follow-up care. The advance is important to help patient to minimize safety problem and responsibility when one the reassessment we look at some erythema, exudate purulent, necrotic need tissue or edems is a symptom sign about one need to clean and debris demand more debris demand and then to the antibiotic therapy must be need and patient maybe need to transfer the higher facility. Oh, I'm so sorry. And then some patient have redness in the wound is about due to infection, but some patients have a reaction of allergic with bandage and with inflammation. The chronic one usually very contaminate and congestion to increase the risk of infection. So this step you need follow up. You need to advance about activity or intervention to this about antibiotic to assessment wound and the contaminant wound. After the unit, the collaboration is a multidisciplinary science with to manage the disaster can be outcome the best practice outcomes. A multidisciplinary approach for the disaster to not only just to help people but to make people not in physiologist but in physiologist aspect. Okay, this is the step 7. It's called G. Collaborates and use multidisciplinary approach. It's a talk about collaboration with one is more severe and infection, uh, the debridement of surgery one and systemic antibiotic uh, always need to manage the wound infection with significantly. Working with the professional teams is part of the multidisciplinary teams is very important to help people with uh, undergoing to disaster impact. So we did not alone or the uh, we team to this problem or this condition. We need to collaborate and use some the disciplinary to help many people with the wound with the many type of wound in disaster, especially to natural disaster. One in the problem in the one when disaster uh, such as access to this area in the victims. The other problem is not electricals. The environment is not hygiene. The the lighting is the bad lightings. The instrument is not the non-sterile instrument. Lack of clean waters. Maybe some have not food, not milk, or not waters. People with impacts to develop the infection of respiration, have a problem with the labors on the pregnancy, uh, maybe uh, any leptocirrhosis or mental condition. Donation about the bandage and the medicine immediately needed for this time. Based on the type of disaster, won't be notes based on many characteristic. The commonly complication is wound infection is 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 happen to do due to of due to contamination with Dutch water spaces on the foreign things, the grazing and the modern products we need use in the bed scam based on the donation, especially K bandage cream, some hydrocolloid alginate and the other tools or equipments. So in disaster, many problem in there, many condition in there, especially we don't know we don't have good facilitation in on-site. We going to help when we going to help the victim or survivor of disaster. But we have first aid to help uh, the people or the victim gets the code from this the step by step. This is a conclusion. Uh, the treatment of one when the disaster is a challenge is a enough bigger with the bigger victims, especially in Aceh, earthquake and tsunami in Aceh, in Lombok, and in Palu. The step is very important is the cleaning and debridement. The cleaning the wound and debridement and give a bandage for wounds, and then we need to assess the wound every 48 hours. The goal is to prevent and to manage the infection. The control of infection can be like a risk for life, and the other body, the other of organs, which in the one in the one area, the the other things you must to collaborate the professional team and some institutions uh, to help people can be to increase uh, the healing process of wound and to improve the quality of life with the patient or the victim in the disaster, especially the natural disaster. Thanks for joining and participating to listen to the presentation. Uh, I hope we understand about the presentation. Thank you so much for your for attention.